Greetings to everyone, it's Malam Dimano, an ongoing physiotherapist from Marwadi University. Today we will be discussing about pressure ulcers, bed sores or decubitus ulcer, whatever you call bro, there are three names. So first of all, what is bed sores? It is injury to the skin or underlying tissues which are present beneath the skin due to prolonged pressure. It is known as bed sores. So this is how bed sores occurs due to the prolonged pressures, and there are some common areas where the pressure ulcer or bed sores occurs. Mainly occurs to the bony prominences of our body. So as we see, if we start from head to toe, first our occiput, the region behind the skull, then there is scapula, wing bone behind the back, then there is at elbow there is a bony prominence which we call olecranon process, that is also bony prominence where the pressure sore can occur. Then you go further, there's the sacrum, which would be also a bony prominences where it can occur commonly. Then there is ischium, then the lateral malleolus, and at last there is heel where the pressure sores can occur. And these were the common areas where the pressure sore can occur. Now let's move towards the goals for the management of pressure sores. The first things you need to do is educate the patient about the condition, what is pressure sores and how to prevent it, or maybe if it occurs, what treatment they need to take. Then furthermore, as I told, prevent the pressure ulcer. You need to prevent it by repositioning, or maybe you can go for mobilization exercise for the patients. Then further, prevent infections. Okay, you need to keep it sanitizing day by day to prevent infection. Relieve pressure. You can relieve it by positioning it, or even you can modify the bed by water bed, which would be like unevening the pressure throughout the body. It would be changing or weighting the pressure throughout the body. The last, promote wound healing. You can go for promoting the wound healing by increasing circulation at that part, or by increasing the oxygenation at that part. The things are here which are goals. Now we will talk about the treatment, how we will implement these things in goals. So first thing, position changing every 2 hours. Okay, we need to change position in every 2 hours for preventing this prolonged pressure which are causing pressure sores. Second thing, we can go for water bed or any soft pads which will like uneven the pressure throughout the body. Okay, you understand, right? What are water bed? Yeah, the third one, mobility training ambulation. Okay, what I told, bed shifting activities. Third, wound healing can be due to you can go for ultrasound by keeping a water bag in between ultrasound and your skin, so it may like prevent infection. You can go for ES, which will promote contraction of muscle. It will also prevent pressure sores. Then you can go for hyperbaric oxygen therapy. What happens in that therapy, like oxygen would be supplied at the area where the wound is there, which will help in healing. That would be promoting wound healing. Then you need to take care about skin hygiene, and last, wound dressing should be done every day. These are the things which are included in treatment. So I hope my video was informative to you guys. Thank you for watching my video.